Hello everyone, my name is Herman Walker. I'm a student at Indiana State University. Today we're going to talk about breast cancer, risk factor and prevention education. For the learning objective, the member of the community will know the definition of breast cancer. Member of the community will know the different type of breast cancer. The member of the community will know the risk factor of breast cancer. The member of the community will know the sign and symptom of breast cancer and breast self-exam method. And the member of the community will know how to prevent cancer. Please take a few minutes to test your knowledge regarding the presence of breast cancer. What is breast cancer? Breast cancer can be defined as a disease caused by uncontrolled development of breast cell. Here you have image of normal breast and then the image with fibrocystic breast cancer. What are the different types of breast cancer? Breast cancer can differentiate based on the tissue or cell affected. Breast cancer can be invasive or infiltrate. It means the cancer has spread to another part of the body, and non-invasive or situ. Cancer did not spread and still confined on the point of origin. The most common type of breast cancer, we have invasive ductal carcinoma. The cancer grows outside the duct and into other part of the breast tissue. Invasive cancer cell can also spread or metastasize to other parts of the body. Invasive lobular carcinoma, the cancer cells spread from the lobule to the breast tissue that are close by. This invasive cancer cell can also spread to other parts of the body. Type of breast cancer, you have inflammatory breast cancer, which accounting for 1 to 3% of all breast cancer. And then we have parasitic diseases of the nipple. This type of breast cancer starts in the breast duct and spread to the skin of the nipple. And then the areola. And this type of breast cancer only accounts for about 1% of all breast cancer. We have the phyllo tumor, the hair breast tumor, and then we have the angiocarcinoma. Angiocarcinoma is a cancer in the inner lining of blood vessel that can occur in any part of the body. This form of cancer will occur in the breast. In this image, you can see the breast cancer lump versus the normal breast cancer. And the sign and symptom of breast cancer, there are no lump in the breast or underarm, armpit, thick or swelling of the part of the breast, irritation or tingling of the breast skin, redness or flaky skin in the nipple area of the breast, pulling in the other nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size or the shape of the breast, pain in any area of the breast. Here we have some statistics about breast cancer. It is important to know Black women die most of cancer compared to white women. In per 100,000 women, you have 126.7 women have affected by breast cancer. White women are most affected by breast cancer as well. Indian and Alaska Native are the least affected by breast cancer. See, they count around 65.2 per 100,000 women. Now, it's also important to know that men can have breast cancer too. We have 1 out of 100 breast cancer, men are diagnosed with breast cancer. And the risk factor for breast cancer, getting older, the more you get older, the more you can be have a risk for breast cancer. Genetic mutation, change or mutation can have an effect in breast cancer. We have reproductive history. Having dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to see tumor on the mammogram. Women with dense breasts are more likely to get breast cancer. Personal history of breast cancer or certain non-cancerous breast diseases, family history of breast or ovarian cancer, previous treatment using radiation therapy, women who took the drug diethylamine or deaths, high risk of breast cancer. Prevention of breast cancer. Breastfeeding decreases the risk of breast cancer. Exercising regularly. If you have been taking hormone replacement therapy or oral contraceptive, instead of oral contraceptive outcome or birth control is better. It's good to communicate with your doctor. Keeping a healthy weight can be beneficial to decrease breast cancer. If you have a family member affected by breast cancer, you have to consult your provider on how to decrease your risk. Breast self-examination 1 week after menstruation period is very important. Here we have a recommendation for breast cancer. Women who are 50 to 74 years old have to at least do a mammogram every 2 years. Women who are 40 to 49 years old should take their doctor or healthcare professional about when to start out often to get mammogram. Women should weigh the benefit and the risk of screening tests when deciding whether to begin getting mammogram before the age of 50. Breast cancer diagnostic exam, we have breast ultrasound, we have diagnostic mammogram, magnetic resonance imaging, we have a biopsy. And the different treatment for breast cancer, we have surgery, chemotherapy, hormonal therapy, biological therapy, radiation therapy. Here we have some site I'm gonna give you more information or education regarding breast cancer. We have the National Breast Cancer.org. We have wuptodate.com contains a breast cancer guide to diagnosis and treatment beyond the basics. Please take a few minutes to do the post-test to test your knowledge and make sure to come back here and check the answer. Here we have my references and thank you for your participation in this education.